Hello, this is Robert Whitaker. I am with Epica Animal Health and Peregrine Radiology. We are teleradiology practice and also manufacturer here at Epica Animal Health of the Vimago high definition volumetric imaging unit, which does CT, 3D CT, fluoroscopy, and digital radiography. Today I'm going to talk to you about 3D imaging in small animal veterinary medicine. I have about 26 years of experience in animal imaging for several organizations over the past 26 years that have brought me to where I am today. Which is basically everything animal imaging, specifically in the small animal world, but also in the large animal realm. We're going to talk about what we're missing. So every day in veterinary practices all over the United States, we're missing diagnoses on radiographs. And for the most part, you know what? Radiologists miss some things too, and it's not our fault. It's just deficiencies in the technology itself. Radiographs did a lot of good for veterinary medicine and human medicine, for that matter, when they came, into normal practice almost 100 years ago. But we can also say the same about ultrasound. Although ultrasound gave us a better view into soft tissue imaging than radiographs ever could have, ultrasound is still extremely user dependent. We can't image through gas. It takes quite a bit of training to get through and to get very proficient with ultrasound. There's some folks that do very well with ultrasound and others that don't do so well at all. So there's a high learning curve for the most part. And sometimes the images just seem nonsensical, and especially to pet owners. So cross-sectional imaging is where we go to next. Slice CT is a technology that's been mostly in the specialty practice hospitals in vet medicine over the last 20 years or so. There are a few general practices that own a slice CT, but the technology is proven. It's been around a really long time. We've seen slice CT operating consistently in medicine for at least 35, 40 years. So the technology isn't a stranger to our industry here in animal health. But we've developed something a little more advanced. There's been some other outfits that have developed other technologies. We're going to talk about those today. But we're going to start talking about slice CT. So first and foremost, you need 2 rooms for a slice CT. One of these rooms actually houses the gantry, the donut here, and the other room houses the operating station or the workstation where the operator sits. And it's a high RPM technology. So to give you an example here, this will show you how fast these things spin. About 400 or 500 RPM is what these machines will get up to. There's a high amount of heat that gets generated in these units, which means we've got to cool the room down quite a bit. We also have a lot more dose and scatter with this technology than some of the newer technologies that are out there today. So it's a high maintenance technology and a high maintenance cost technology. It works well with internal medicine and orthopedics. Mostly when we're talking about veterinary applications, we're looking at cats and dogs larger than 10 pounds is where it really performs the best. The larger the patient, the better it's going to perform. But for the most part, we're limited in this technology down to about 1 millimeter of resolution. So another technology that came out, and I got a pretty good amount of experience with cone beam CT when I was over at Webster or Patterson. This technology can fit into a single room. and it's low RPM, lower dose, lower maintenance than slice CT. But the limitations that we see with cone beam CTs are that we can only do dentistry, skulls, and extremities in our small animal patients. And we're limited on what we can see with soft tissue applications with cone beam CT. You know, if we've got a pretty small patient, let's say, a Chihuahua, normally, we can get decent views of the abdomen using contrast with a cone beam, but that's about where it stops. They're so underpowered. Most of these cone beam units don't have any more than 5 kilowatts of power, so it eliminates their use in a lot of our larger small animal patients, specifically in things like large dogs, tortoises, etc. So resolution is going to vary with the manufacturer in the cone beam world. Many of these units are a 1 millimeter kind of a resolution, and there's a few out here I think that are getting down to 0.5 millimeter in resolution, which is pretty good. But we just see them applied mostly in dentistry. That's where their sweet spot really is. So you're still spending 6 figures for a cone beam CT, but your applications are limited. So when we look at the Vimago HDVI platform, it's got some similarities to what goes on with cone beam units, and it's got some similarities to what goes on in some slice CT units. But it is single room technology, low RPM, low dose, low maintenance. But we're going to apply this technology across more species and more sizes within those species than any other technology that's out there. Not only that, it's a platform. It has 3D CT on board. It has fluoroscopy on board, which is live X-ray. It also has digital radiography on board. So we can spread our use of this machine across all disciplines of veterinary medicine or veterinary medical imaging, which includes dentistry, orthopedics, internal medicine, from the size of a mouse to the size of a mastiff. Our resolution typically on large dogs is at 600 microns, but we can go all the way down to 90 microns, let's say, if we're scanning things like avian, parakeets, mice, etc. Most of the time in dentistry, we're scanning at 150 microns or 200 microns. And for most of our patients, we're at 300 microns in the abdomen or the thorax. So the biggest difference when we compare what our Vimago does against a conventional slice CT is the data set that's collected. So the data set in a slice CT is exactly as it sounds. It's cut into slices. And the only real data that we're acquiring out of the patient is on those slices. The gaps between them, there's no data there. Now the computer in some cases can indicate data in between those slices. That's called interpolated data, but it's not real. The Epica unit, the Vimago, captures the whole density of the animal with no gaps, and then moves to the next section of the animal and captures the whole density with no gaps. It does all this robotically. And what this does is it gives us a 3-dimensional map of densities in the animal from head to tail, or whatever anatomy we choose. And it allows us to see everything that we want to see inside the animal without worrying that we've missed something that sits in between gaps, so to speak. So this is more of a illustration of what that may look like. We can dial slice CTs to go down to a real low pitch or a real narrow slice gap. The newer the CT units are, the narrower we can get these gaps. But we're also increasing dose to the patient when we do that. So it creates a real, conundrum or a dilemma when we're trying to get higher resolution out of slice CT. We can't really do small patients all that well. We don't see a lot of avian or reptile or even small dogs, toy breeds, getting very good images soft tissue wise or orthopedically out of slice CT because of this gap issue. And this is the reason that we can't utilize slice CT in dentistry applications in the small animal world. So this gap situation, is troublesome. And interpolated data is not data at all. It's not real. Filling in gaps with false data, we can't really call it false data. We just call it interpolated because it's estimated on the previous and succeeding slice values. So it's more of a guesstimate, but it's still not real. So you have to remember that when you're shopping for cross-sectional technologies for your general practice or for your specialty practice, no matter what your situation is, that you need to know that only Vimago can find answers on a variety of case types that include internal medicine, which is mostly soft tissue imaging in the abdomen and the thorax, orthopedics, which is bone tissue imaging and some soft tissue imaging in joints and different parts of the musculoskeletal system. And then also we're covering dentistry, which includes animals from rabbits, chinchillas, all the way up to very large dogs, where we can see everything from abscesses, masses, fistulas, fractures, resorption, tooth fragments. We see everything at once, and we can see all of these things in 3D. Only Vimago can also cover this broad spectrum of species and sizes. So we're looking at canine, rodents, reptiles, avian, all sizes of avian, by the way. That's from a very tiny parakeet all the way up to, a large raptor, such as an eagle or a falcon. Fish, as small as a skate, tiny little, ray type patients. We have lots of machines that are in aquariums. And of course, dolphins also. There's certain sizes of dolphins that we can cover with the Vimago. The Pegaso is Vimago's larger sister system that has a much larger gantry, and it works in equine and also in aquariums. So we get much bigger in a dolphin. We're going to use the Pegaso instead of the Vimago. Amphibians, turtles and tortoises. Again, there's some tortoises we can scan with the Vimago. They'll fit through the gantry. There's others that we need to scan with the Pegaso because they're just so big. And of course, feline, from the small house cats all the way up to the very large cats, that we get from Africa or other parts of the world. So we have a wide variety, a broad spectrum that we're covering both in species and also in discipline. So to give you some case examples, this is what a dentistry case would look like in 3D. In the far left of your screen, you're seeing a 3D image of a skull. It's a maximum intensity 3D image, which means it's black and white, it's not color. But you can see that there's this dead tooth or this big pulp cavity lesion here in the insides, or the canine, I'm sorry. And then, of course, we have puppy teeth in the bottom right illustration. And then we've got lissus indicated here under the 405 tooth. And then we've got a fractured tooth up here in the top right image. So this is what we're using for dentistry day in and day out. Dentistry helps. Most of our clients are general practices, and dentistry is a large part of helping this equipment earn its keep in the general veterinary practice. Ears and noses are a big application that we see with Vimago, also in general and specialty practices. We're seeing a nasal mass that's invaded the oral cavity here. It's a fistula, essentially. So it's just real easy. We can see this in what we call the multiplanar view. So we have a sagittal view here in the top left. We have a what we call an axial view. This is our traditional CT view that we would see with slice CTs. And then over here we have our coronal view, or you can call it a ventral view or a dorsal view, ventral dorsal view, but we call it a coronal view in cross-sectional imaging. So we have 3 dimensions on the screen in front of us, or we can actually render it into a 3-dimensional model on the screen, like what we saw back here in dentistry with this skull. Ear masses, problems that are in the inner ear. When we start talking about ear infections, whether it's otitis media, otitis externa, masses in the ear, we can see a mass here. We can definitely see, in both sides, what's going on in the ear canals all the way down to the tympanic bulla. All 3 of these views are of the same patient, just different aspects. And then when we get into the brain, about 80% of brain masses that we're seeing in dogs and cats are visualized using intravenous contrast with the Vimago CT. Now, the 20% that we can't see, the only reason we cannot see them normally is because they do not have a blood supply, and those need to be seen with MR or MRI, magnetic resonance imaging. But 80% of the cases that we get in these dogs that come in with neurologic symptoms where we're thinking, well, maybe there's a brain mass, we can use our Vimago. We can deliver intravenous contrast, which is iohexol. Dosage depends on weight of the animal and, of course, concentration of the iohexol you're using. And then, a few minutes later, less than a couple of minutes usually, we have an image on the screen indicating whether or not we've got a mass in the brain. So we have one specific patient here on the far left where we're showing the sagittal and axial views of the brain mass in this canine patient. The top right is also representative of the same patient, different but same patient, top and bottom images of sagittal and axial views of the brain mass. And then of course we have this 3D color image of a different mass that is more or less mineralized, even though we did use contrast imaging on this animal. The thing would have lit up without contrast simply because there was some type of mineralization going on with that lesion. But we're always recommending, if we're scanning for brain masses, that we're going to be using intravenous contrast to do so. Mineralized disc material normally never shows up in RADs unless it's so horrible and so mineralized that you do see it. But we do pick it up right away in imaging with the Vimago using our CT. And of course, if someone wants to use myelography and inject a little bit of contrast into the spinal canal, you can use myelography with the CT, with the Vimago CT as well. Elbows. No one enjoys taking elbow radiographs because, well, let's face it, there's so many different oblique views, and we have to do oblique views of both so we can compare left to right. But with Vimago, we can image both of those elbows together in one scan, and we can see all the way around each of those joints in 3D and in 2D. So a much easier, much faster way to diagnose problems, elbows in dogs and cats. Of course, in this situation, which is very different and very unorthodox for a case that comes into a vet clinic, this is tragic. Chihuahua was injured at the groomer, and there was an accident where the Achilles was severed, and so the dog came in, and the veterinarian used his Vimago to evaluate the Achilles tendons, and here we can clearly see where there was definitely a rupture here in the Achilles tendon. A slice CT could never see this. Radiographs could never see this. We can pick this up very easily with the Vimago unit. So that just demonstrates the power of the soft tissue imaging technology that exists with the Vimago. So let's move into some interesting cases for this section. We're going to start with an 85-pound canine patient that cannot urinate, obviously a male, given the radiographs on the screen. So the dog came into the vet clinic and could not urinate at all. They performed ultrasound exams on this dog's bladder, and they did not see anything that would indicate a blockage. There wasn't any stones, present in the bladder, although there was a little bit of debris, or what they would call a bit of dust debris in the bladder. So after RADS and ultrasound in the general practice, this did not work out. The next best thing was to refer the patient. So the patient was referred to a second practice that possessed a Vimago. They scanned this patient and found urethral stones. So had they put the ultrasound probe on, the proper place, could they have seen it? Possibly. If they would have catheterized the dog, could they have figured maybe there was a blockage there after the catheter would not have been inserted, or the Foley? But of course, that was not attempted either. So essentially, this pet and this owner have ended up going to 2 practices and spending over $1,300 to find out that there were urethral stones. If we had scanned this patient from the beginning with Vimago, we had had a very different result, I think, and been able to see everything much more clearly and quicker. So you can see the 3D color here. You can see the stones. It's pretty cool technology. So we'll move into another case now. We've got this 9-year-old canine with severe neck and back pain. So radiographs were taken. This dog you could not even touch. You couldn't touch its back in physical exam without it crying out in pain. It was a really sad situation. So we have lateral and VD radiographs here that are really not showing us a whole lot. We're seeing the spine, not much going on that in the RADs that are telling us that there's a source for pain in the spine. And of course, we're looking at the chest, and we can see that the chest isn't, really giving us much indicators either of anything wrong. The shoulders, etc. Now, they had a Vimago. They went ahead and scanned this animal, and lo and behold, the first thing they noticed is when they scanned the thorax that they had nodules in the lungs. Now, radiographs did not pick this up. We could go back to the RADs and we could look and say, well, yeah, maybe there's something there. But at first blush, when we're looking at these radiographs, we're really not looking at tissue in the chest. We're looking for something that's going to give us an indicator of pain in the spine. But we went ahead and picked up the chest with the Vimago scan, and of course find nodules. So the next thing it picks up in the Vimago scan of the chest and the abdomen is lymphadenopathy. So of course we're using IV contrast. The lymph nodes are now lighting up, and it's showing us that there's definitely some lymphadenopathy going on in the patient on top of lung masses, but we're still not finding a source of pain. And then we finally get to the source of pain in the spine, which is osteomyelitis. So you have all these lesions in the vertebra. If you'll see as you look down the spine here, they're just terrible. And then in 3D color, you can see these lesions once again, specifically down here toward the lumbar. There's a huge one down there. So now we have a lot more information on this patient than we could have ever dreamed of getting out of radiographs just by using the Vimago. Again, here's another view of these lytic lesions that are in the vertebra. And we can see it here, not only in the sagittal view, but we're also seeing these lesions right here and right here in the axial views of the spine. We've all had the troublesome GI foreign body that we know is probably there, but radiographs aren't showing it. And in a lot of cases, the animal's too gassy for ultrasound to show it. So we've got this 99-pound German Shepherd. She's 9 years old. She comes in for a wellness visit. She's not sick. She's not showing symptoms. There's no vomiting. There's no diarrhea. There's nothing to indicate that she has something wrong. Now, we all know that some of these dogs, specifically larger dogs, can be very stoic, even though they're in pain. So the physical exam pretty much renders a normal result, but part of the wellness program at this specific practice uses radiographs. And so they took radiographs of the chest and the abdomen. It's part of their wellness exam protocol. And they saw something that just wasn't right in the stomach area. And I have the rads, I'll show them to you. And basically something wasn't right. Something looked circular, didn't belong there. So they went to their Vimago. So here's the rads. And you can see here in the left image, we got stomach over here with ingesta. We've got another half of the stomach laying over here with something that looks to be circular in it. You can't really see it over here in the lateral, but I'm pointing to the area that we should be seeing something there, but we just don't see it. So the doctor says, you know what, let's put it on the Vimago, gets permission from the owner, and sure enough, the Vimago reveals that there's this gastric foreign body in the stomach, and probably has been there for some time, and it's a ball. This is a ball the dog had swallowed who knows how long ago. So very interesting, because this dog was not showing symptoms. This was an asymptomatic, non-clinical German Shepherd coming in for a wellness visit. And here we have it in 3D color, where we're seeing it from the coronal view on the left side of your screen, and on the right side of your screen, you're seeing it from a lateral or sagittal view. So it's clearly a circular, spherical, GI foreign body that we would have never known about had A, we not been doing wellness exams in this specific practice, and B, taking radiographs as a part of that. And we have some Vimago user hospitals that are doing wellness exams with a Vimago scan. Some of them has several levels of wellness. One level's only radiographs. Another level is, well, we're going to do a Vimago scan of the dog's skull so we can see the teeth. And while we're under anesthesia, we're going to go ahead and do a thoracic and abdominal scan to see and make sure that everything's going well there. So now we're going to get into a little more detail with orthopedics. So we get a 60-pound Great Dane, 8 months old, extremely lame in the front limbs, extremely painful. The dog barely can get up, and it's only 8 months old. Radiographs weren't showing us anything. Now, the treating veterinarian was immediately thinking in her differentials that there was wobblers going on here. Wobbler's disease is very common in Great Danes. We all know this. So they referred it to a neurologist, and the neurologist actually has a Vimago in the practice. So it got used on the dog to see if there were wobblers indicators in the cervical spine. And here's the radiographs. So the radiographs weren't helpful. You can still see the growth plates are definitely open here, but really it's hard to tell. This is not something that we're going to look at from a radiographic perspective and go, yeah, that's our pain. That's got to be where the source of our pain is. It's just not. When you look at the radiographs, you think, wow, there's something else going on here. It can't be just this. And so the dog ends up at the neurologist. They do a cervical spine scan, and the cervical spine is perfect. So now there's a mystery. Now, the orthopedic surgeon said, scan the shoulders. And guess what we see? The radiographs were massively underrepresenting the situation in the shoulders, simply because we are only using a 2D plane. But when we're able to go and take three-dimensional cross-sectional images of these shoulders, we get to see everything that's going on in both sides. And both shoulders are riddled with degenerative joint disease. Just terrible, horrible lesions. Swiss cheese, so to speak. You'll see a 3D come up here in just a second. And as the 3D shoulder joint turns, you'll be able to actually see through some parts of this shoulder. And this is genuine proof that we're just missing things with radiographs. It's not our fault most of the time. It's just a limitation of the plain film or plain digital technology. Plain is in PLANE. The plane is only one when we need to have multiple planes looked at. So here's the 3D image. And as it rotates around, you'll be able to look at the lateral aspect of this joint and see right through it, right there. So now we're going to get into fluoroscopy. So, on the left, we have a fluoroscopic exam of a collapsing trachea. And now on the right side, we have the actual treatment that can be delivered to some of these collapsing trachea patients, which is a tracheal stent. So we're going to use the fluoro not only to diagnose the situation, but we're also going to use the fluoro to, do the treatment with the, implement the tracheal stent. And then in this situation, we have on the left side of the screen, this is a dog that we're looking at as a swallowing situation for a mega esophagus. This dog couldn't hold much down, so we had to determine using contrast imaging, using barium, how the dog swallowed and why there was definite chronic vomiting with this patient. So easy to diagnose. With fluoro, we could see mega esophagus with radiographs, but we can't really see it in action. With fluoro, we can see it in action and get a way better diagnosis and a better indication of what's going on. Now, on the right side of your screen, you're going to see a kitty here who has trouble swallowing unless she turns her head to one side or the other. And so this was an interesting case because the actual owner couldn't figure out why the cat was always turning its head when it was eating. Well, this is the only reason that it was because it couldn't swallow. So when the cat would eat, it would chew, and then it would turn its head and then go back to eating. And now mystery solved. Using fluoro, we could see that. Radiographs would never tell us what's going on in that situation, and of course ultrasound wouldn't either. And then when we get into other vascular anomalies, portosystemic shunts, tortuous vessels, things like these are seen easily and quickly with a contrast study in the Vimago. So we can detect shunts in 3D and show them in plain sight quickly. Our chief radiologist, Dr. Bob O'Brien, calls the Vimago the shunt machine because it's his favorite modality to use and to diagnose shunts with. So anytime that we've got pups coming in the door exhibiting symptoms, that there might be, a shunt, typically we've been tasked with grabbing the ultrasound. Well, those of us who've done quite a bit of ultrasound over the years still struggle with finding shunts using ultrasound. There are some who are super talented because they kind of specialize in shunt scanning with ultrasounds. So, they can see it and diagnose it a lot faster than those of us that don't see it as common or as often. But now, when you have a Vimago in practice, shunts are simple. We just go ahead and get approval from the owner to do the Vimago scan and deliver the IV contrast. And within, a couple of minutes, we know whether or not we have a shunt. If we're still unsure, we can send it off to our radiologist, Dr. O'Brien or Dr. Taylor, and they'll be able to diagnose where the shunt is and send you pictures of it back. So when you're putting a technology like this into a vet hospital, it's a serious investment. We're looking at, an investment that rivals that of homes in some places. When you look at, what the spend is on this technology or slice CT technology or even, a cone beam technology, it's a six-figure spend every time. And that's just when you buy the equipment. And then, of course, you got to look into what are the maintenance costs, what are the service costs, what kind of warranty are on the parts, etc. But what really, really makes the Vimago highly successful is how we're using it in a general practice or a specialty practice. It doesn't matter, because we're going to try to use it the same way in every situation. We need to use the Vimago first at every opportunity. And a great example of that is the shunt situation, where do we want to really dive off in an ultrasound and try to dig up a shunt on the screen with an ultrasound for 45 minutes or an hour? Or do we want to go ahead and go to the Vimago and get a result right away and know that we've got a shunt right away? So we're wanting to skip over our radiographs and our ultrasound at every opportunity that we can. I'm not saying this so that we can reduce, what's going on with imaging in those departments. I'm saying that because we're just going to get better answers faster. We know it with the Vimago in a lot of situations. Why even waste the time going to get rads? And the second concept that makes this super successful has a lot to do with the first concept, and that's charging affordable fees. We can use the Vimago first in a lot of cases when we're making it affordable. But if you look at the way some of our specialty hospitals are charging for CT, in a regular basis, you'll see them charging $2,000 and $3,000 for CTs of dogs and cats. That is cost prohibitive in a general practice, or in some cases, it doesn't matter if it's a specialty practice or a general practice, it's cost prohibitive. An owner sees that and goes, good Lord, if I don't have pet insurance, how can I pay that? So charging affordable fees is a key to using this machine on a regular basis. Consistent attendance of imaging CE at Peregrine Radiology. At Peregrine, every single week on Wednesday, we're giving 12 noon in, I believe it's 12 noon Central Time, we're giving a webinar. Now, some of those webinars are very straightforward. We're talking about ultrasound and x-ray. Others we're talking about CT and MRI. Others we're talking about all of those things. And then once a month we have rounds on a Wednesday. Every month we have a webinar with imaging rounds, and it's allowing us to look at patients using all aspects, all types of imaging, all types of species. So we go through several cases, Dr. O'Brien or Dr. Taylor, over the last month that they've seen with different cases coming into Peregrine Radiology, and they impart the wisdom that they've gained from seeing these to you. So using CE that's available at no charge from Peregrine Radiology is also a must in making this technology highly successful, because it helps you continue to shift your paradigm away from what you've known for the last 5, 10, 20 years in diagnostics to what's now new and available to you, that you have a Vimago, sitting in the next room. So how do you get a Vimago into your practice? Well, there's a couple options. You can rent one of these machines, which means it's a 5-year program that, you pay a certain amount every month, and everything's covered, service, warranty, everything all in one fee. And at the end of that 5-year period, then you trade that in for, a new Vimago and rent that one. Buying with cash or financing is the other option. So this is the typical option that a lot of folks choose to do. There's financing programs that are out there right now that are pretty good when it comes to interest rate. The options that we see our veterinarians choose on a regular basis are those that are offered with 6 months or 12 months and no payments. That helps ramp the technology without a lot of upfront costs, and get it going and get it accepted and used into the practice with all the training we need to do with the staff without it costing the practice right off the bat. If you have any more questions, which I'm sure you do, you can just give me a call or send me a text message, send me an email. I really appreciate your attention today, and thank you.